Good morning, students. Today's lecture is on global health. These are the learning outcomes. At the end of this session, students should be able to define global health, list various global health issues faced by Malaysia and other countries around the world, explain global health initiatives. Global health is the health of populations in a global context. It is defined as the area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. Global health can be measured as a function of various global diseases and their prevalence in the world, and a threat to human life in other parts of the world. So, disease and prevalence of disease in any part of the world is a threat to human life in other parts of the world. Now we will see why global health is important. Diseases do not respect boundaries like HIV/AIDS, tuberculosis, influenza, Ebola, Zika, and now COVID-19. All these, they are not respecting boundaries. They are spreading across the countries. Okay. COVID-19 pandemic now spread to 212 countries. Okay. 1.872 million cases and 116,017 deaths as per 13th April 2020. Okay, so you understood within a matter of 4 months it spread across 212 countries and caused a major burden on health system across the globe. Health of each of us increasingly depend on the health of the others. Okay, why global health is important? Many children in poor countries get sick and die needlessly from malnutrition or from diseases that are preventable and curable. So, countries across the globe should help each other to prevent the health problems in other countries. Many adults in poor countries die because they lack access to medicines that are available to people in rich countries. Health is closely linked with economic and social development in an increasingly interdependent world. So, economic development can improve health, social development can improve health. Children who suffer from malnutrition may not reach their full mental potential and may not enroll in or stay in school, so they cannot develop into a productive citizen. Okay. Adults who suffer from HIV/AIDS, tuberculosis, malaria, and other diseases lose income while they are sick and out of work, which is a major contributor to keeping their families in an endless cycle of poverty and malnutrition. Okay, so that's very sad condition. Now we will go through the historical development of the term global health. First, the term was public health. Public health developed as a discipline in the mid 19th century in UK, Europe, and US. Okay, it was concerned more with national issues. Okay, public health was focusing more on national level issues, data and evidence to support action. So they collected national data and evidences to support public health action. It focused on population, instead of individual patient. Medical care was focusing on individual patient, but public health focus on populations. Public health focus on social justice and equity. So that's why public health is, services are provided through public institution or government sector, because it is interested and focused more on social justice and equity, and emphasis on prevention than cure. Okay, emphasis is on prevention. Now the new term evolved was international health. International health developed during past decades. Okay, came to be more concerned with diseases, tropical diseases. Tropical diseases were more on underdeveloped countries. Okay, and conditions like war, natural disasters of middle income countries and low income countries tended to denote a one-way flow of good ideas. So, developed countries were helping middle income countries and low income countries which are affected by diseases like tropical disease and conditions like war and natural disasters. It was like a one-way flow from developed countries to middle and low income countries. Then the concept evolved as global health. Global health is actually a, uh, they transcend national boundaries. Okay, resources from any part of the world can help any part of the world. More recent in its origin, and he emphasizes a greater scope of health problems and solutions across boundaries. Okay, that transnational boundaries require greater interdisciplinary approach. Now we can go through the factors affecting global health. Okay, determinants of health of any country can affect global health. Determinants of health of any country. Then measurement of health status of any countries. So measurement of health status of any country, morbidity or mortality or any health condition or risk factor of any countries can affect global health. Importance of culture to health. Cultural factors can affect health of a country. Whatever affect health of a country can affect global health. Global burden of diseases. Okay, some diseases are more in developed countries, some diseases are more in underdeveloped countries. All this can be a factor affecting global health. Key risk factors for various health problems: organization and function of health systems, that also can affect global health. Now we will go through the determinants of health. What are the determinants of health? Can be genetic makeup. Genetic factors can affect health. Familial conditions, familial factors. Age of individuals can affect health. Gender can affect. Some diseases are more among males, some diseases are more among female. Lifestyle choices like sedentary lifestyle, dietary patterns. Okay, unhealthy dietary practices can affect health. Community influences. Okay, there are so many cultural factors and community influences can affect health. Income, socioeconomic status, cultural factor, and environmental factors. Okay, geographical location can affect health. Culture can affect health. Environmental factors can affect health. Work conditions, education, okay, access to health services, okay. The right side is showing the diagram on determinants of health. It is adopted from Dahlgren. Okay. So there are so many factors are there. As you as you can see, agriculture and food production can affect health, education, work environment, work stress can affect health, lack of employment can lead to poverty and malnutrition, living and working conditions, unemployment can lead to poverty and poor health. Water and sanitation. Earlier we discussed about environmental conditions, right? Water and sanitation, waste disposal, solid waste disposal, pollution. Okay, healthcare services. Okay, healthcare services can also affect health. Housing. Housing can also affect health. Overcrowding can lead to many diseases, right? Social and community networks, individual lifestyle factors. As already told, sedentary lifestyle, dietary pattern, and psychological factors. All these can affect health. Okay, some more factors coming under determinants of health that can affect global health. Okay, political stability of countries. As all of us know, if a country is having so much of war and a political instability, that can affect the health system of the country and the health services can get affected. Okay, health of people residing in unstable countries or war inflicted countries or conflict inflicted countries can have poor health, right? So political stability of countries can influence health. Civil rights of countries. Some countries give so much respect to human rights and civil rights, so give importance to safety. They consider health as a human right. Those type of countries will have better health facilities. Environmental degradation. Okay, as part of natural disaster, as yesterday's lecture, natural disasters can lead to environmental degradation and it can affect health. Population growth. Okay, because of increased fertility, increased birth rate, increased migration. Okay, as part of war and other conflicts, people migrate from one country to another for better life. So that can also affect health. Okay, urbanization and industrialization. More industries, more development in cities. People move to cities. Then the health infrastructure may not be enough to meet all the health need of people coming to the cities. Okay. Determinants of health include, okay, nutritional factors like malnutrition, okay, can lead to diseases, more susceptible to diseases and less likely to recover. Okay, understood. Malnutrition. Cooking with wood and coal. In many areas, in many countries like underdeveloped countries and in many parts of India, people use wood and coal for cooking purposes. It can lead to indoor air pollution and lung diseases and some type of cancers. Okay, because of the smoke, indoor air pollution. Poor sanitation facilities can lead to more intestinal infections, food and waterborne diseases. Okay, poor life circumstances. Okay, there's poverty, poverty and lack of employment, poor socioeconomic status can lead to people will be forced to do commercial sex work and it can lead to sexually transmitted infections, HIV or AIDS. Advertising on tobacco and alcohol. Okay, tobacco and alcohol. Some countries will not have any restriction on tobacco and alcohol. So it can lead to addiction and related diseases. Tobacco can lead to lung diseases and various type of cancers. Alcohol can lead to liver diseases and psychological disorders, social disorders. Okay, and suicides, road traffic accidents, all these can be linked to alcohol. Rapid growth in vehicular traffic because of the increased population and the increased population migration, more traffic, more vehicular traffic with untrained drivers on unsafe roads. It can lead to road traffic accidents. Now, the second factor which affects global health is the measurement of health status. Okay, causes of death. Okay. Many countries may not have the system to collect data on causes of death. Okay, so uh, death certification is the measure to record causes of death of the country, but it is limited in many countries because of incomplete coverage, because of the improper health infrastructure. So many countries don't have the information, adequate data on causes of death. Life expectancy at birth. Okay, many countries will have very high life expectancy at birth. Like you take Japan or highly developed countries will have life expectancy more than 85. But there are many countries in the world where life expectancy is still less than 60, underdeveloped countries. Life expectancy is the average number of years a newborn baby could expect to live if current trends in mortality were to continue for the rest of the newborn's life. Maternal mortality rate, that is also one indicator of health of a country. Maternal mortality rate is the number of women who die as a result of childbirth and pregnancy related complications per 100,000 live births in a given year. So life expectancy, maternal mortality rate, and causes of death of different countries, all these can affect the global health. Infant mortality rate. Infant means those children below 1 year of age. Number of deaths in infants under 1 year per 1,000 live births for a given year. So infant mortality rate. Number of deaths of infants below 1 year, children below 1 year of age per 1,000 live births. Neonatal mortality rate means neonates are children below 28 days. Okay, or infants below 28 days is neonate. Number of deaths among infants below 28 days in a given year per 1,000 live births in that year. That's a neonatal mortality rate. Please keep in mind, infant mortality rate means children below 1 year. Neonatal means children below 28 days. Neonatal can be divided into early neonatal and late neonatal. Early neonatal means first 7 days. Late neonatal means after 7 days but before 28 days. Okay. 28 days is neonatal. 7 days is early neonatal. After 7 days, before 28 days is late neonatal. Understood? You will learn more in pediatrics. Child mortality rate. Probability that a newborn will die before reaching the age of 5 years. Expressed as a number per 1,000 live births. So up to 5 years is known as child mortality. number of children dying before the age of 5 years divided by total per thousand live births per year. That's the child mortality rate. Now we will go through the cultural factors and health. There are so many cultural factors which can affect health. Traditional health systems. Many countries, people follow traditional healers and a traditional health system. Okay, they spread lot of misconceptions. Okay, like about various practices like uh, not using vaccination and not taking medicines and avoiding modern medicine. So many misconceptions are there. Misbeliefs about health. Like I will give two examples. One about epilepsy. Epilepsy, all of us know, it's a disorder of neuronal depolarization, and these cultural beliefs are there in many countries that it is because of the possession or bad omens and by the ancestors. Okay, psychosis is a serious psychiatric disorder. Okay, it is considered as ancestral problem requiring assistance of traditional healer or spiritualist. Okay, so they don't go for treatment, they go for advice from traditional healer or spiritualist. In many countries they go to astrologer, they get their advice. Okay, influence of culture on health. Okay, okay, there are so many cultural influences can lead to marginalization of people. Some people will be marginalized, discrimination, and inequalities due to race, gender, and ethnicity, or religion, or some other uh, factors. Okay, so culture and health, you have to think about the cultural factors in many parts of the world that can affect global health. Okay, global burden of diseases. Okay, so please keep in mind predicted changes in burden of disease from communicable to non-communicable disease between 2004 and 2030. Okay, the World Health Organization has predicted in 2004 more number of communicable diseases were there. So they predicted that by 2030 more number of non-communicable diseases will be there. Reduction in malaria, diarrheal diseases, tuberculosis, and HIV/AIDS, and increase in cardiovascular deaths, COPD. COPD is chronic obstructive pulmonary disease, road traffic accidents, and diabetes mellitus. So many non-communicable diseases will increase in the population. In different parts of the world, non-communicable diseases is increasing. That will affect the global health. Okay. Increase in aging population in middle and low income countries. Okay, population is towards slowing down. Population growth is slowing down. Many countries have reached declining phase of population. Okay, and number of young population is shrinking, but number of older population is increasing in many countries, including middle and low income countries. That can affect the global health. Key risk factors for various health conditions that can also affect global health. What are the major risk factors? One is tobacco use related to the top 10 causes of mortality worldwide. Okay, it can lead to many type of cancers. Tobacco is having so many carcinogens, and it can lead to various type of cancers. And tobacco is containing nicotine. It causes so many other diseases like cardiovascular disease, cerebrovascular illness, stroke, hypertension, and poor sanitation and access to clean water, lack of access to clean water. related to high levels of diarrheal diseases and waterborne diseases. Okay, poor sanitation can lead to waterborne diseases and foodborne diseases also. Okay, and diarrheal diseases, food poisoning, all these things. The reduction in condom use or safe sex practices can lead to various sexually transmitted disease, sexually transmitted infections, HIV, AIDS, all these things. These all are key risk factors which can affect global health. Malnutrition. Malnutrition includes undernutrition and overnutrition. Okay. Undernutrition can lead to increased susceptibility to infectious diseases, and overnutrition responsible for cardiovascular disease, cancers, and obesity. Okay, cardiovascular disease because of high fat diet, overnutrition, high calorie diet. Okay, carbohydrates convert to fat inside our body. Cancers. Sometimes high fat diet can lead to some type of cancers like carcinoma breast or colorectal cancer, like that. Malnutrition, overnutrition can lead to obesity. Obesity is a major risk factor for most of the non-communicable diseases like diabetes, heart disease, obesity, diabetes, heart disease, hypertension, all these things. Now we will go to the next factor, next determinant of health. Next factor which can affect the global health, organization and function of health system. Okay, poor health infrastructure in many countries. Okay, many countries are facing lot of conflicts, wars, and other unstable conditions. Okay, it can lead to poor health infrastructure, poor functioning of health systems. In many countries, health system is not functioning in a better way. Poor functioning of health system, lack of political commitment because of corruption. Many countries are having so much corruption and the funds for health programs are not reaching the grassroots level. Understood? So corruption is there, lack of political commitment is there, and inadequate funding or prioritization on health. Many countries, even if their health system is very poor, they are giving very less amount of budget to health. They give more budget to military development and uh, other areas. Give less funding to health and education. So that's one problem faced by many countries. It affects global health. Okay. Now we will move to the last part of the today's lecture. These are the global health initiatives worldwide. Okay. There are so many initiatives by WHO. WHO focus on global health initiatives for different diseases. Okay. Now we are discussing on global health initiatives by CDC. CDC is Center for Disease Control and Prevention, US government. Okay. So what is the vision of CDC? A world where people live healthier, safer, and a longer life. Okay, so people all over the world should be healthier, safer, and they should live for longer period. That's a main vision. Mission. Mission means how it is achieved, how the vision is achieved. Protect and improve health globally through science, health policy, partnership, and evidence-based public health action. Okay, these are the various actions. Protect and improve health globally through science, policy, that is health policy, partnership with various agencies and various countries, the evidence-based public health action. So evidence means we have to look for the latest proven research. proven research evidence, and we have to apply that proven research evidence for public health action. Now we will go through the goals. These are the goals for Global Health Initiative by CDC. Okay. Goal 1 is the health impact. Okay. Health impact should be there. Improve the health and well-being of people around the world. That is a goal 1. Okay. How to improve health and well-being of people around the world? Through collaboration and through applying latest evidence-based public health action. Okay. Health securities. Improve capabilities to prepare for and respond to infectious diseases. So there should be so much facilities for identification of disease and respond to infectious diseases in other countries. Improve capabilities to prepare for and respond to infectious disease. Other emerging public health threats and public health emergencies. Okay, so these are the 3 things. Improve capabilities to prepare for and respond to various infectious disease, public health threats, and public health emergencies. Goal 3 is health capacity building. Build country public health capacity. So public health infrastructure to be built, more facilities should be there, more laboratories should be there, more trained personnel. If health workers are there, they should be trained. Okay, CDC and WHO are sending people to different countries to train health workers so that their health capacity can be built. Organizational capacity. Maximize potential of CDC's global programs to achieve impact. So organizational capacity means they are training the health staff and health managers of different countries in organizational techniques, leadership and management. Okay, so these are the different goals of Global Health Initiative by CDC. Now, what are the strategies? Okay, CDC provides technical expertise to countries. I told you earlier, they are sending the trained personnel to different countries to give training from top to bottom. Top means leaders of underdeveloped countries, they give training. Then leaders and managers, they give training. Then health workers are of different category. Doctors will be there, nurses, midwife, and community level epidemiology field workers will be there. Okay, health workers will be there. They give training to them, technical expertise to them. Implementing evidence-based public health programs. So they will give guidance which public health program will suit to the country. So they are giving instructions on latest evidence. Okay, latest evidence available on public health. Okay, so an underdeveloped country can adopt a research which was done in a developed country, and they can adopt to different strategies which suit to them. Okay, so implementing evidence-based public health programs. Then third one, they help to develop surveillance system and a strategic information system. Okay, many countries, they don't have good surveillance system. They don't have active surveillance and passive surveillance to identify the diseases in the country. So the CDC and World Health Organization will help them to develop a surveillance system and a disease recording system. Registration system should be there. disease reporting system should be there. That all will be developed by CDC and World Health Organization, developing surveillance system and a strategic information system. Okay, earlier we discussed about health information and management system, right? Like that, they develop the information system of the underdeveloped countries and middle developed countries, so that they can identify the cases in a better way, translating research into public health policy and practice. They help in public health policy development of underdeveloped countries. So CDC and WHO will help how to develop a public health policy and how to develop a public health practice. Many countries, they will be very good in clinical care, but they may not be very good in public health policy development, public health guideline development, and a public health program development. So CDC and WHO will help them to develop that. Okay. Now, fifth one. What is the strategy? Building public health workforce capacity. I told you there are so many workforces there, like doctors, nurses, midwives, health workers, and laboratory workers. So they build public health workforce capacity. So WHO will give training to them so that they can work in a better way. Doctors will be trained to identify the cases, to about the guideline for diagnosis, okay, guideline for diagnostic methods, okay. Microbiologists will be trained on newer microbiology technique, laboratory techniques, all these things, okay. And the field workers also will get more training how to identify the cases in the community, strengthening laboratory system. So they give some funding to buy newer machines, to buy newer diagnostic techniques, the diagnostic machines like um, newer techniques like PCR. All of you know, for COVID, coronavirus, and we have to diagnose coronavirus using PCR technique, RT-PCR, reverse transcriptase PCR. Many countries are not having that facilities. They have to send to nearby country to diagnose, right? So WHO and CDC can build the laboratory systems um, in different countries, improving emergency preparedness and response capabilities. Okay, so like disaster preparedness, countries will be prepared for emergency. Okay, like that. So CDC and WHO will help in emergency preparedness and the response capabilities. Okay, there should be laboratories where they can test the cases immediately, or testing kits will be made available to the countries, and hospital facilities will be uplifted so that more specialist care will be given at a hospital. Okay, many countries they start airlifting of patients from different areas, like different remote area. They use helicopter services to bring patients to district hospitals and national level hospital. In Malaysia it is done, it is implemented successfully. They are using helicopter services to bring patients to district hospitals. Okay, so that's a response capabilities, conducting monitoring and evaluation activities. So they themselves do how the working of the health system, and they do research to know the problems faced by the health workers and the health department. Why they are doing research? To identify the problems so that they can solve it. Okay, Please keep in mind, I told you about CDC and the World Health Organization. CDC is Center for Disease Control and Prevention, and the World Health Organization is a international agency. There are so many other agencies like a Melinda Bill Gates Foundation, or then Bill Clinton Foundation is there. Okay. Then there are so many international agencies like UNICEF is there. Huh? They are all giving global health initiatives to improve the health of underdeveloped and medium developed countries. Now, the references, this material was taken from Essentials of Global Health and a Global Public Health New Era, that's also, and a Park's textbook of preventive and social medicine. Hope you understood.